If you have ever had a urinary tract infection, you know it is miserable. The burning, the constant urgency, the feeling that something is just wrong. And for a lot of people, especially women, they keep coming back. So it is no surprise that people are searching for ways to stop that cycle before it starts. Probiotics have become a popular idea in that conversation. But does the science actually back them up? Let's start with the basics. Probiotics are live bacteria and yeasts that are beneficial to your health. Your body already contains trillions of bacteria, some helpful, some harmful. Probiotics add more of the helpful kind. You can get them from foods like yogurt with live active cultures, kefir, sauerkraut, and kimchi. You can also take them as capsules or powders. The most studied strains belong to groups called Lactobacillus and Bifidobacteria, and these are naturally found in the human gut and vaginal area. Here is why that matters for UTIs. Most urinary tract infections are caused by a bacteria called E. coli, short for Escherichia coli. It normally lives in the gut without any trouble, but when it migrates into the urinary tract, it causes an infection. Women are at higher risk because of anatomy. A shorter urethra means bacteria have a shorter distance to travel. Factors like sexual activity, certain birth control methods, menopause, and a history of previous UTIs can all raise the risk further. The vaginal microbiome, the community of bacteria in the vaginal area, also plays a real role here. A healthy vaginal environment is typically dominated by lactobacillus bacteria. When that balance gets disrupted, harmful bacteria can move more easily toward the urinary tract. That connection is exactly what researchers started investigating when they looked at probiotics as a prevention tool. The research shows some real promise, but it is not a slam dunk yet. Studies have looked specifically at two strains, Lactobacillus rhamnosus GR1 and Lactobacillus reuteri RC14. These strains have shown encouraging results in reducing UTI recurrence in some women. However, a 2015 review in the Cochrane Database of Systematic Reviews, one of the most rigorous review sources in medicine, found that while some strains appeared helpful in certain groups, the overall evidence was not yet strong enough to call probiotics a standard prevention method. More large-scale trials are still needed. So where does that leave you? If you are interested in trying probiotics for urinary health, look specifically for products containing those two strains that have been studied. Consistency matters. Taking them regularly over time is more meaningful than occasional use. Pairing probiotic foods with prebiotic foods like oats, bananas, and garlic can also help good bacteria thrive. And probiotics are just one piece of a larger picture. Staying well hydrated helps flush bacteria out of the urinary tract. Urinating after sexual activity is something many providers recommend. Wiping front to back matters. Avoiding scented soaps in the genital area helps maintain bacterial balance. If you are getting UTIs frequently, that pattern deserves a real conversation with a licensed provider. There may be underlying factors driving the recurrences, and a provider can help you build a plan that fits your specific situation. If symptoms are already present, burning, cloudy urine, frequent urgency, or pelvic discomfort, do not wait it out. UTIs are generally treated with antibiotics, and getting care promptly matters. A video or phone visit through SendClinic can connect you with a licensed provider from home. No waiting room required.